Hey guys, Dave Taylor, realworldstrength.net, training secrets. So everybody's been really good so far in hitting the like button on my page, and I just wanted to pay everybody back and show you a little something that my man Yusuf asked me, which was how to fix patellar tendonitis. I'm going to come back to that in a second, but first off, let's just talk about general knee pain. Squatting, deadlifting, jumping, running, sprinting, everything athletic you can think of, and everything below that is at some point in your life probably going to cause you some knee pain. And this isn't a fix-all, but this is just a couple of little hints and tips that I use with my clients, and I've used even with myself, just to alleviate the problems. Now, number one, always go to the doctor, always get a professional's advice on this if this is a real chronic problem. But what we're trying to address is why a lot of these things happen, and a couple of really obvious, glaring things that I see on a daily basis that I'm fixing every day, and that I just want to kind of get out there and educate people on. So I've got my trusty Kong, and what we're going to do is we go straight to the front of the quads. So hopefully, maybe I see this very well. I'm not got a cameraman with me right now, but the front of the quads here, what we call rectus femoris, vastus intermedius. These two muscles are, responsible for knee extension. So if these muscles are super tight and super short, then what you've got is you kind of got a battle between the fact that there's certain muscles that are pulling you into extension, and you've got a battle going on with the other movements, muscles that want to make you do flexion. So what we're going to do is try to address those tight muscles. Normal rolling up and down the muscle, like I said before, isn't quite going to do it. We need to go across the muscle. We get the ball, we get the Kong, we get the lacrosse ball, medicine ball. The roller, again, isn't going to do it. It's too big, it's too cumbersome, and we need to get really specific. So we're going to get the ball, we're going to go down into a quad stretch on the floor, but you're going to go across that muscle, okay, or those two muscles. You're going to figure out in there very, very quickly, if you've got knee pain, what's the most painful part. And what you're going to get is you're kind of going to get this kind of clunk, clunk going over that thigh. And when you feel that muscle, when you feel that cable-like muscle going over there, you're just going to want to go across that. Keep the pain scale again at a 5, 6, or 7 out of 10. But you're just going to want to keep going across that muscle. Now, that can take a little while to recondition. I suggest doing it every day for a couple of weeks. Hopefully you'd see pretty instantaneous decrease in pain, but sometimes it can take a long while to recondition the muscle itself. So we're going to go across the muscle and make sure that we're attempting to sort of not just roll along it and stretch it out, because it's not going to get stretched out. We've got to recondition it to make it a bit more pliable. That's one tip. I'm going to do a bunch of others as we go through the week, but when we talk about knee tendonitis, Yusuf asked me, how do I get rid of patellar tendonitis? Quite honestly, the simple answer is this. Tendonitis is an irritation of the tendon. It's an inflammation irritation. There's not a lot you can do for it. Really, unfortunately, I'm not a doctor. I'm not going to tell you to take anti-inflammatories or NSAIDs or anything like that, even though I have on occasion. But it's rest. And so unfortunately, when these things happen, what you've got to do is you've got to go away and figure out what it is that you keep doing that is irritating this particular area of your body. And I guarantee there is one thing that you are doing on a daily basis that is irritating this. So if you do a lot of squatting every day, if you do a lot of lunging, if you do a lot of jump training, sprint training, or even if you're somebody who does a lot of driving, the position that you will sit in on a daily basis, this will be a very, very repetitive thing. You'll think nothing of it, but start to try and think about it, and you'll find that one thing that if you stop doing, then 9 out of 10 times the tendonitis will start to subside, and hopefully it won't flare up again. But it's an irritation and inflammation, and unfortunately, when it comes to post-rehab therapy and personal training, there's not a lot we can really do about it apart from rest. So do me a favor, subscribe to the page. There's going to be a lot more in-depth stuff coming up. But subscribe, like. Thanks for watching. Tune in next time. Take care.